So, depression, anxiety, depersonalization, those are the sort of things that have been bothering me for years. So this is the reason I'm trying out TRT. And this is what I'm on. Testosterone 250, Depot. That's what I've been prescribed by a doctor, a private doctor. To hopefully try and sort this mess out, this mess in here. Yeah, like I said, depression, anxiety, depersonalization, if I can say that right. Things been bothering me for years and years and years, and I've never quite understood really why. Well, I know why. I've been like everyone else, been through a few things in life, but I should be happy now. I should be happy, and I can't figure out why I'm not. There's something wrong with me why I'm not, because everything's going fine in life. I've got a alright job now. I own my own house, not outright, but paying a mortgage. I've got a lovely girlfriend. I've got pets. So this is what I'm trying to figure out. So I've been to NHS before. I'm not bashing at NHS because my girlfriend works for the NHS. I love the NHS. I love her, so I would never bash it. I think it's amazing. But a few times now I've been on off antidepressants for 10 years. I've asked for a testosterone test and they give me one once. But this one I didn't really understand the depths of it to what I do now. And they just said I was within the normal range. And I didn't even question it. I didn't ask whereabouts I was on this range, at the top or at the bottom, at the middle. I don't know, I didn't ask. I just took their word for it because I had full trust in them, as you do. I was on my way, just thinking, well, there must be something else wrong with me then. So maybe I am depressed. Let's have the depressants, and they give it to me. So I've been on Sertraline. Sorry, I'm just drinking me a nice cup of tea because I'm from England. We like a cup of tea. So yeah, I've been on antidepressants a couple of times. Sertraline, I was on that. I literally just come off. Did I say Sertraline or Citrapam then? I've been on Citrapam. I was on Sertraline going back last year. Been off for a year, just over a year now. I was on 100 milligrams, and just done nothing for me, nothing whatsoever. But when I forget to take one, I get these I think they're called brain wobbles. And randomly throughout the day, if you forget to take one for a day, you'll be walking along and all of a sudden, bop, 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 your head just goes like that and you just go all dizzy. And I work at heights on scaffolding. So when that's happening to you, it's scary and dangerous, and it just shouldn't be happening really. So that used to scare me. I decided to start weaning myself off going back January last year, onto CBD oil. This is a CBD oil I still am using. Love CBD. It was alright actually. It was alright. I tried coming off antidepressants a few times and it's just horrible. Absolutely horrible. Those brain wobbles were just getting worse and worse and worse. My mood was going up and down. It was just horrendous. So I was using, this is 800 milligrams. I was doing 2 squirts in the morning before I go to work. A squirt at dinner time and 2 squirts when I got in, so a fair amount. But I just needed something. And I think it was working. It was working. Because it was making the brain wobbles better. It was just, in general, I felt a bit better taking all that. But this is still not getting me to the root of the problem. So I watched loads and loads of podcasts, especially Joe Rogan, things on bodybuilding and fitness and things. And a lot of people because it's mainly American based, a lot of people chatting about TRT, testosterone replacement therapy. So I'm from the UK, as you know. I wasn't going to go back to the doctors again, not the NHS doctors, and try again, basically. I just wasn't going to do it. So I took it onto myself to try and find a private doctor. I went online and I pretty much found one straight away, to be honest with you. And they've been very good. I done an initial blood test, a finger prick, and it come back very low testosterone. So my testosterone level was, on the finger prick, 0.53 nmol, when it should be between 8.64 and 29. So I'm literally just there. It should be 8.64, mine was 9.5. And it could be right up to 29. So I'm right at the bottom end of that. Free testosterone, mine was 0.23, and it should be between 0.2 and 0.62. Is that right? 0.6. Yeah, that is right. And my SHBG is 21. No, I think that's hemoglobin, but I've got no idea what that means. So if anyone can help me out on that, please do, because I've got no idea what that means. So after a long talk with the doctor, telling them all my symptoms, a bit about my diet, and brief history with things that I've done and etc. Which is, I've taken quite a lot of drugs in my time, drank a lot of alcohol in my time, had a few problems in my time. Don't judge me. Alcohol and fags are actually the biggest drug that there is, and I hardly drink anymore and I don't smoke at all, so don't judge me. So yeah, I used to take a lot of drugs. Not any hardcore, not any many party drugs. No heroin or crack, but pretty much everything else. Good times, good times. So he asked the question, would I be interested in taking hormone replacement therapy, testosterone replacement therapy? And I said, well, if it's gonna help my mind, then yes. Anything that could have the possibility of sorting my head out, I'm gonna jump at. So I jumped at it. So these come through along with HCG. It'd be 2 weeks Friday since I've been on it. So I'm basically taking 0.2 mil on a Friday of testosterone, 0.2 mil of HCG on the Saturday. Then I'm doing 0.2 mil of testosterone again on the Tuesday and 0.2 mil of HCG on the Wednesday. So altogether I'm doing 0.4 mil of test and 0.4 mil of HCG a week. Now I think I'm got a bit of placebo at the minute because I feel a little bit better than normal, tiniest little bit, but I think that's just hope and placebo and excitement really of maybe finding something which is gonna make me feel better, give me some motivation to get back into the gym. I used to love the gym. I used to really be fit and healthy, but the thought of actually lifting anything heavy now, I just can't do it. And I struggle in work. I struggle massively actually lifting things. I'm at a puff easy, and my mind's just not there. I can't concentrate on anything. I think it's called brain fog. I just can't concentrate on anything. And when I finally do get in from work after trying to concentrate all day, sometimes the missus is chatting to me and it's like, oh God, that's all I can hear. And the dogs want attention and I'm trying to concentrate on the TV and I can't. All I want to do is learn about what's going on inside my head and TRT basically. See if I can make myself feel better. Sounds a bit selfish, but if you can't get your own head right, how can you help anybody else? If you can't love yourself, how can you love anybody else? And I have suffered bad inside. My natural weight is about 13.5 stone. I had a bad episode not long ago. I'll just be honest. Drank a bit of alcohol and crashed my van, and I lost my job because of it basically. And I went right down to 12 stone just because I went so depressed and anxious, and I was in a bad place. Yeah, I lost about 1.5 stone, and I felt like I was eating fine as well. I felt like I was eating as much as what I normally would, but I didn't know, maybe the stress and anxiety I don't know, just lost all that weight. But when I'm back to my natural weight, and I feel like I could get back into the gym now as well. I feel like I've got a bit of motivation in me to try and get back into the gym, put more weight back on, get some muscle back to me, get fit again. I've got to start running as well because I got a half marathon in 2 weeks time, and I ran 2k yesterday. Like I said, I got a bit of motivation. I ran 2k and I was knackered, absolutely knackered, so I don't know how I'm gonna run 20k, but I'll give it my best. But I'm going to be doing an injection video next, I think, what I do with my injections. But yeah, if anyone's got any questions about their personal experiences, you know, the best thing to do is just talk about it. So leave me a comment, we'll talk about it, we'll try and get better together.